Hello, my name is Walter and I suffer from a respiratory condition. So my GP has described the Easi-Breathe inhaler. I'm going to show you how to use the Easibreathe correctly. The information I'm going to give you is a quick, basic guide, and I recommend that you keep and read the instructions that come with your inhaler. First, I want to cover some important points about your inhaler. I want to talk you through how to use it before I show you how to use it. Then, after that, I want to talk to you about how to clean and store your inhaler, how to know when your inhaler is finished and when to order another one, what to do if you mistakenly miss a dose or take too much, and what to do if you have to go to the clinic or the hospital. Some inhalers are given to prevent flare-ups, so use them regularly. They will not prevent flare-ups if only used when your condition worsens. This is because they can take some time to work. The Easibreathe inhaler is a metered dose inhaler, or MDI for short. The drug is delivered direct to the lungs via an aerosol which you inhale. This is an Easibreathe inhaler. This is the dust cap which covers the mouthpiece. At the top you have air vents which must not be covered whilst in use. You only need to test your inhaler when it is new or if you haven't used it for 2 weeks or more. To do this, you must release 2 puffs of medicine into the air. This is done by opening the mouthpiece, pointing the mouth away from you, unscrewing the top, placing your forefinger on top of the canister and releasing 2 puffs. When you're finished, replace the top, close the mouthpiece, and your inhaler is ready for use. You should take your inhaler at the same time every day. You can take your inhaler with or without food. Stand or sit upright. Keep your head in a neutral position. Hold the inhaler upright, taking care not to cover the air vent with your hands. Check the inside and outside of the mouthpiece and remove any dirt, dust or other objects. You do not want to inhale these. Breathe out as much as you can, but do not breathe back in. Place the mouthpiece in your mouth and seal it with your lips. You do not need to bite on it. Breathe in slowly and deeply. You will hear the inhaler click. When it does, continue to breathe in. Once you have breathed in all the way, hold your breath for as long as you can, up to a maximum of 10 seconds. Then breathe out slowly. Replace the mouthpiece cover. If you need to take another puff, wait 30 seconds. Breathe out as much as you can, but do not breathe in. Place the mouthpiece in your mouth and seal it with your lips. You do not need to bite on it. Breathe in slowly and deeply. You will hear the inhaler click. When it does, continue to breathe in. Once you have breathed in all the way, hold your breath for a maximum of 10 seconds. Then breathe out slowly. Replace the mouthpiece cover. If you need a second dose, wait for 30 seconds and repeat the procedure. Brush your teeth and or use a mouthwash to rinse out your mouth to prevent mouth problems. Some inhalers can cause dry hoarseness or mild mouth infections. Clean the mouthpiece and inside the rim of the inhaler at least once a week. Do not push the tissue inside the inhaler. Close the dust cap. You should protect your inhaler from frost, direct sunlight and heat. You should place your inhaler somewhere that will help you to remember it. The living room or the bedroom are good places to store your inhaler. If you forget to take your inhaler and remember within an hour or two, take it. If more than that, miss the dose and catch up with your general dose next time round. Do not take the missed dose. If you have taken more doses than you should, you must contact a health professional for advice. You will know it has run out when it stops spraying. When it nears the end, you should order another. Order your inhalers only when you need them, because drugs can expire. It's very important that you take your inhalers and a list of all your prescriptions to the hospital when you're attending any appointment. A list of your repeat prescriptions would be most helpful.